Hi, this is Dr. Ryan Suh. I'm a Gonstead NYC Chiropractor in Midtown Manhattan. In this video, we're going to talk about frozen shoulder, also known as adhesive capsulitis. So we're going to talk about what it is, what causes it, and how we fix it. Okay? So frozen shoulder is characterized by, you'll have some patients, they'll try to lift their shoulder up, okay, in their arm. They have no problems going up to 45 degrees. But once they start to try to get up to 90 degrees or so, they have a lot of trouble doing so. And try to go past 90 degrees all the way upwards, it's almost impossible, okay? Because it's so stuck, okay? And also a lot of discomfort is expressed. They have a lot of trouble doing so. So part of the component is all the ligament and the scar tissues and also the tendons, they start to lock up, okay? There's also a lot of inflammation in the area as well. In addition to, they also have a lot of trouble trying to get their arm behind their body, okay? So as long as they try to reach behind their backs or things like that, okay? So they'll have a lot of trouble doing so, or it's pretty much impossible. Either going from the back or from the front. So what causes it? Well, there's two particular components to it, okay? So we'll talk about the most common one, what I see in this clinic, okay? This muscle group over here is a trapezius, also known as a traps. Okay, so we have a particular nerve that goes to this muscle that exits from the base of the skull and enters into the traps. Okay, so whenever we have a structural misalignment on the upper part of your neck, but more importantly, that causes your skull to misalign, what happens is there's an obstruction to it. So when there's an obstruction to this nerve and it blocks it, this muscle is no longer functioning as well as it should. So therefore, it gets a little locked up. And since the traps are attached to the shoulder itself, okay, that's part of the reason why that joint capsule itself, they start to get inflamed and start to get stuck in place. Okay, so number two, okay, and this is a little less common. Okay, but this is also some things I've noticed as well. The deal is this. This is the latissimus dorsi muscle, known as the lats. There are 2 points where it connects to. The lats attaches all the way from here, okay, and also attaches to tendinous components down to the pelvis, and also anchors itself all along the lower part of your spine, the lumbars. Okay, so when we start to have a structural misalignment in the lower part of your spine, it can tug and pull on these muscles. Okay, so in essence, what happens is part of that problem where you just have a lot of difficulty going beyond 90 degrees. Yeah, the lats will try to pull things down because the primary responsibility of the lats is pull things towards you, pull upwards, okay, and also going backwards as well. So. So again, when we have a structural misalignment in the lower part of your spine over there, it really tugs on that muscle and doesn't allow it to function properly. Okay, so those are the two major components to it. So how do we correct it? Well, we determine which one is the actual problem. Okay, through structural radiographs and through a structural integrity examination, we determine, is the problem located here that's blocking off this nerve, or is there a severe misalignment somewhere either in the lumbars or in the pelvis, okay, the lower part of your back, or the foundation that's causing the muscle to be tugged really hard? Okay, so now we're going to jump right to an X-ray case. I'm going to show you one of the more complicated ones where this person actually had both of them. In this X-ray case, just like what we discussed before, misalignments in the upper part of the neck can cause problems to the accessory nerve, okay, resulting in the trapezius muscles to lock up. Okay, so normal, these two lines should line up. It should be parallel. Abnormal, that's what we're seeing here. The lines diverge, which indicates this skull over here, what it does was, it shifted moving forward and upwards, resulting in this space over here, where the accessory nerve comes out, it gets constricted right at this level. So by realigning the skull, moving it backwards, and inferiorwards, sliding it back down, gives it more space to this area over here, freeing up, removing the constriction to the accessory nerve, resulting in the trapezius muscle to relax. We're now looking at the lower part of the spine. Okay, this is the low back, the lumbar area. I drew a line at the back of the 5th lumbar and the 4th lumbar. Now, normal, these two lines should line up, just like railroad tracks. This line, as you see here, is 4 millimeters backwards in relation to this one over here. So this one, this bone, is our problem. And this is what causing her double whammy, both her trapezius and her lats, to result in the frozen shoulder. So by realigning her occiput, freeing up the nerve to the accessory nerve, calming the trapezius, and also the 4th lumbar, realigning the 4th lumbar back to where it needs to be, taking the tension off the lats, resulting in both muscles to relax, freeing it up, and help resolve and fix her frozen shoulder. So I hope you find this information very useful. So please like, share this video on your timeline. Got any questions? Leave a comment below. I'll answer them. Thank you. Have a good day.